Hey, do you think you might have sciatica? I'm here to tell you the top 4 signs that you've got sciatica. My name is Dr. David Midoff, physical therapist, and I'm the owner of Paso Manual Physical Therapy. Let me go into the top 4 signs that you'd likely have sciatica. Sign number 1, low back pain and stiffness. Now let me break this down for you. Most people that have sciatica that come and see us in our clinic also have either an active case of low back pain or they've got a history of low back pain. And it's not just pain, it could also be stiffness. Let me tell you the difference. Pain, low back pain, pain in the lumbar region of the back means that it stops you in your tracks, doesn't let you sleep at night, maybe taking some pain medication for it or seen a doctor for it. You may have been told you have a herniated disc. That's what I'm talking about. Stiffness is different from pain in that it usually doesn't hurt, but the muscles back there feel tight and you don't feel very mobile in your low back. That type of situation, usually people deal with just fine. They can get through their day, they can do what they want to do. It doesn't stop them in their tracks. They never feel like they have to take pain medication, but there's some stiffness back there and it worsens usually with chores around the house, especially vacuuming and sweeping, and chores outside the house like doing gardening or yard work. So if you've got a history of back pain as well, maybe it's not active right now, you have sciatica right now, you think you might, but your back doesn't really bother you, but in the past you've had back problems, that is a high indication that you likely have a sciatica issue today. Sign number 2. The classic sciatica presentation is pain into the buttock and the thigh. Now usually people get pain right in the meat of the butt, in the thickest part of the butt muscle. That's where the sciatic nerve passes through an important area, and then it runs down into the back of the thigh. So people will get pain into the top of the thigh, the middle of the thigh, or even all the way down into the back of the knee. That's the classic presentation for sciatica. But some of the not so common presentations for sciatica that people tend to miss is pain on the outside of the thigh and the front of the thigh as well. We often get people that come in to see us for a sciatica problem. Well, they may not even know it's sciatica. They come in saying they have pain in the back and pain in the thigh. They may have been told by somebody that it wasn't sciatica because they're pointing to pain on the front or the side of the thigh. But what's happening is in most sciatica cases, there's other things that happen with the joints and muscles that can set off pain in the side of the thigh and the front of the thigh. And even though the sciatic nerve does not pass through there, it can cause some pain and discomfort for people experiencing active sciatica right now. The top 3rd sign that you've got a sciatica problem is that you can't get comfortable in any one position. 9 out of 10 people that come and see us for sciatica, this is a common complaint they have. They say, I can take sitting for a while and then I have to stand up. After a while of doing that, I have to go sit down again, and the only place I can get comfortable for a while is the recliner. We hear that all the time. People that are working at a desk job, they say they're miserable when sitting there. They can't sit through a movie. Driving is terrible because they're stuck in the car until they get to their destination, and they just can't, it's annoying. They just can't live and function normally because they can't get in one position for any given amount of time. Now that's an extreme case when people come in to us and see us and they're writhing in the couch. They're sitting on a comfortable, cushiony couch here in the office and they can't get comfortable because of the sciatica issue. Now that's an extreme case, but a less severe case, these people can tolerate an hour or more sometimes of sitting before they have to stand up. Or they can tolerate standing and doing stuff around the house, chores and working before they have to take a break. Now that type of sciatica issue it's tricky because it's not severe and it's not really limiting them from doing anything. So when we talk to those people and we ask them, what is it stopping you from doing? They'll say, nothing, I could do whatever I want. But after an hour I have to take a break. After an hour I have to stop the movie. I have to walk around. They'll say stuff like that. So if that's your situation, then I would count this as one of the signs factoring in towards your likely sciatica situation. Sign number 4, pain when sleeping at night. Now this shows up in 2 different ways. Some people have trouble falling asleep at night. It's bedtime, they get ready for bed, they go lie down, and then they're just tossing and turning. No pillow ever makes them comfortable. They can't find the right place to put a pillow. They start thinking that they need a new pillow, they need a new mattress. They try sleeping on the floor sometimes. We get those people in all the time, and they just can't get comfortable. If that's you, you're missing out on usually an hour or 2 or more of sleep, and you need to get a solution to this problem so that you can fall asleep when it's time to go to bed. Now, the other presentation for having trouble sleeping at night because of a sciatica issue is they can fall asleep, but they'll wake up at 1 or 2 or 3 o'clock in the morning, and then they can't go back to bed. That's a tough situation because you're missing out on a bunch of sleep. Now, in severe cases, people are taking pain medication or sleep medication to get through a full night's rest of sleep. But in less severe cases, the ones that I am more concerned about, truthfully, is when people say, I don't hurt a lot during the day, my sciatica problem doesn't bother me a whole lot, I can sit and stand and do nearly whatever I want, but I'm missing 2 to 3 hours of sleep a night or more. These people come in looking tired, they haven't rested, their health's going down the tubes because their immune system's down, and they're just not getting the full amount of sleep that their body should be getting because of this sciatica issue. They're waking up with cramps or pain at night in their leg or in their back as well because of this sciatica issue. If that's you, you need to get a natural resolution to this problem so that you can get a full night's rest. It is vital for your health. So there you go, the top 4 signs that you've got a sciatica problem. Some low back pain or stiffness or history of it, pain in the buttock or thigh, anywhere on the thigh, can't get comfortable in any one position for as long as you like, and trouble sleeping at night, either falling asleep or waking up in the middle of the night. So there you go, the top 4 signs that you've got a sciatica problem. Some low back pain or stiffness or history of it. Some low back pain or stiffness or history of it. Pain in the buttock or thigh, anywhere on the thigh. Can't get comfortable in any one position for as long as you like, and trouble sleeping at night, either falling asleep or waking up in the middle of the night. Please explore our website to learn more about sciatica and other ways that we help people stay healthy, active, and mobile while avoiding unnecessary surgeries, medications, and injections. If you're interested in hiring us to help you solve your sciatica problem, please call us at 915-503-1314 and ask about our free discovery visit option for our Facebook followers. If you're skeptical, uncertain, or worried that we might not be able to help you with your sciatica problem and nobody ever will, it's okay and it's normal. We hear it all the time. I've got something for you though. If you'd like, you can request this free guide. It's called The Top 10 Tips to End Annoying Sciatica Pain Using Natural Solutions to Avoid Unnecessary Surgery, Injections, and Painkillers. Written by me. You can request this and get it immediately sent to your email. You can download it from your email. Just find the button nearby and fill in your info, and you'll get it immediately in your inbox. Check your spam folder. Sometimes it goes there accidentally. Or you can call us and request that we mail a copy. We'll make a copy for you and we'll mail it out to you so you can get it at home. This guide is a compilation of the top 10 tips that we've given to our clients over the years here in our clinic to help them with their sciatica issue, and they're proven to work. Now, not everyone will work for everybody. You've got to experiment a little bit, especially if you're doing this on your own at home. You've got to experiment and see what works best for you. We're available to talk to you and help guide you to the best solution for your sciatica problem. I wish you the best of luck. Have a wonderful day.